Hi, this is Leo Segal. I'm a physician scientist in the Pulmonary and Critical Care Division at NYU School of Medicine. I'm here to tell you a little bit about our experience with the current pandemic and how we directed our research interests into microbes in this pandemic with the support of the of SARI-PREP. When the pandemic hit us in March 2020, not only I became a full-time critical care intensivist, but also my lab research refocused from the other projects that we had into COVID. My lab focuses on microbial host interaction and the use of culture-independent techniques to uncover those interactions. So we were quite well suited to try to see what was going on in the lower airways of these patients. With the other centers in SARI-PREP, we were able to build an extensive cohort of patients that are critically ill, intubated on mechanical ventilation, in a large percentage of them, and we're looking to develop novel ways to investigate what's going on either in the lungs or in their systemic circulation that can explain the tremendous variability in how patients evolve with this disease. No, and one of the initial interest that we had was whether these patients were getting a super infection or a co-infection with another respiratory pathogen or another type of pathogen that we were not treating it efficiently. So that was one of the first observations that we start making, that these patients they're really not getting co-infected or super infected that often, and when they do, we are treating them quite broadly with antibiotics and antimicrobials, and using these type of methods that we have developed, culture-independent methods, as well as based on culture results, we can start seeing that at least the poor outcome on these patients was not driven by this type of super infections. This was something that was of a concern at the beginning of the pandemic, especially because we knew that from other pandemics, from respiratory viruses, such as the influenza pandemic in 2018 and from H1N1 in a few years back, there was a significant concern that patients were getting co-infected with another pathogen, and that was driving the mortality on these patients. I think treatment has changed quite a bit, and supportive measures are very different. So in the current pandemic, at least we can say that patients are not super infected, especially not that often at the beginning of presentation when they come to the ICU. And then while they are in the ICU, they are treated aggressively with antimicrobials, and it doesn't seem like there are another pathogen that is driving the mortality. Rather, what's key driver of the poor outcome on this patient is really viral replication from SARS-CoV-2 that is not well controlled and inefficient antibody-specific response against SARS-CoV-2. I think this is the type of investigations that one can do once you have a supporting system to build this large cohort of patients, of well-characterized patients with a biorepository of samples that you can use to conduct this type of investigation. That's, I think, a key mission for SARI-PREP, and hope that will lead to new discoveries that will help fight this pandemic and end it as soon as possible, as well as be prepared when the next pandemic arrives. Thank you very much.